Aynen.
Şöyle. Password. Şuradaki. Aşağıdaki mi? Aşağıdaki.
Yes, yes, the last one. Good morning.
Morning.
We just waiting for one more student, or let's start. Okay, hello everyone. We have to see your face during this session, okay? Could you please open your cameras? Thank you. Thank you. We are just waiting. Two more friends. And how are you this morning? Are you okay? Good. As I said yesterday, because we had the icebreaker last evening, now we are going to start with our questions. Okay, as soon as we are ready, we are waiting for the friends, expecting Ismail to come. Hopefully he will be with us. I just want to remind the ones that hasn't got any experience in MUN. I want to remind you that you have 2 minutes of time, and when you are left with 30 seconds, I'm going to inform you just like this. And when you are left with 15 minutes, I'm going to inform you again so that you can sum up what you are trying to say. Okay?
Okay.
Thank you. We are waiting for Ismail, but our first question is going to be, is it acceptable that virus outbreaks are normal events in our lives, or it's how much we follow and practice sanitary laws? We are going to discuss about it. Maybe you would like to have the chance to think about it. I will repeat it. The first question, hi, hello. Our first question is it acceptable that virus outbreaks are normal events in our lives, or is it how much we follow and practice sanitary laws? This is what we are going to discuss. This is our first question, COVID-19. Yes. Who would like to go first? Yes, Abdullah, please.
Okay, according to the question, good morning to everyone, first of all. According to the question, I think, yes, it is acceptable because of the examples of virus outbreak is flu, influenza, and cough, and many other more. And it is spread every year in every country. So I think it is acceptable that virus outbreaks are normal events in our life. I think so. Like, this is my opinion. This is my answer. Thank you.
Thank you, Abdullah. Anyone else? Yes, Zeynep, please.
I think no, because we're not seeing those kind of viruses a lot. I mean, we can say rare for them. So it shows that it's not normal. It's a kind of thing which is extra. And also, I do think it's about sanitary laws because it's, when we're looking, it's just spreading mostly in the dirty areas. Like, it comes from China. And we know that China is not a kind of place which is so clean. And when we're looking SARS, it comes from the same place as well. We are not seeing those kind of viruses coming from like Norway or those kind of clean and like improved places. So we can easily say that it's about sanitary laws.
Okay,
Thank you.
thank you. Yes, Sarah, please. I think you have to open your microphone, Sarah. Yes, thank you.
Firstly, we all know about coronavirus. It is a whole country's problem, and unfortunately, it's a deadly virus. We have so many deaths so far. It shows us how big problem it is. We must take this serious. That's why we have to follow and practice sanitary laws. Otherwise, more people are gonna die. According to the coronavirus cases number, we are practicing the laws. Some countries have already stopped the virus, but some countries which is not taking this serious have more deaths. We can see it clearly, I think. Thank you.
Okay, thank you. Yes, Shawal, please.
I think accepting it as normal means kind of suicide, because there's a problem that costs our health in case we violate the social distancing or even don't wash our hands. And just because of that, thousands of people died since today. And because of them, because most of them thought it was normal and they continued their usual life. And I think it's the biggest problem that we have to overcome. We have to notice the power of the virus. And as citizens, we have some responsibilities to the other citizens, because anyone out there has risk infecting us, and we have also risk to infect other people. So personal hygiene and social distance are very, very important. And in my opinion, we should be well informed about the whole sanitary laws, and that's why we have to follow and practice them. And I think this is the way of reducing the spread of the virus, and this is the best we can do as citizens.
Okay, thank you. Anyone else? Yes, Mariam, please.
As everybody knows, coronavirus is a worldwide topic because people are dying all over the world. This kind of viruses have always been throughout history, but it doesn't mean we don't have to prevent it ends on its own. But this is wrong idea, because if we don't get that serious, we can lose most of scientists and intelligent people. Because of this world probably can fall back. So of course we have to practice sanitary laws.
Okay. Gentlemen, I would like you to open your camera so that when you want to speak, I can see your hands when you raise your hands and let you talk about the topic. Okay, all of you think, I assume that all of you think that viruses are acceptable. Okay, but we have to take care of the sanitary laws. We have to be careful about them. Do you think that we should blame the country? I mean, do you think that this happened to all the people in the world just because of the unfollowed sanitary laws of a country? So should we blame them for this reason? Because do you think that we were aware of sanitary laws before the virus came to our lives? I mean, this reminds us, I think, to do what, I mean, were you can give examples from your lives. Were you washing your hands for 20 seconds at least? Yes, Shawan.
Honestly, I don't wash my hands as much as I do now. But now I'm scared to, and when I touch somewhere, I feel like I have to wash my hands, and it's kind of a good habit that we take from this coronavirus.
So do you think that a kind of serious problem remind us to take care of sanitary laws more seriously than before, right?
Yeah, definitely.
Yeah. Okay. If you are not going to add anything more, I'm moving on to my second question. And it's going to be, are the taken preventive measures enough to fight coronavirus? Do you think the precautions that we are trying to make real in our lives are enough to get rid of this disease. Okay, Sarah, yes, please.
I think that taking preventative measures are enough to fight coronavirus. As I said before, some countries have already stopped the virus. It shows us how it is possible to decrease deaths without vaccine. Of course, vaccine is the best solution for the viruses, but since we don't have it yet, we continue to take preventive measures and they seems like they are enough.
You think they are enough? Okay, Şevval, I think you would like to say something.
Since the countries first met the COVID-19, they all reduced travels, prohibited massive gatherings, and made closures or some things. To give an example, Germany has a common national pandemic plan, which has 4 targets. That is really important. And US raised the fines for violation of social distance. And in Turkey, children under the age of 18 and retires over 65 cannot go outside. And in most of the countries, all bars, restaurants are closed. As we can see, the world is doing their best to protect themselves. Nevertheless, these measures are not being enough to stop it because health is not the only problem we have. Because clearly, trying to save the economy make it harder to increase our measures at some points. So I think economies prevent to take big measures.
Okay, thank you. Abdul, you were about to say something, I think.
Yes, I think the taken preventative measures are enough to fight this coronavirus. If we continuously act upon these measurements, if we leave these measurements, those are like the government are saying to us, like they are ordering us to follow the measurements. If we are lazy to follow them, then it is very difficult to fight. But if we continue to follow them, then of course the measures are enough to fight coronavirus.
Could you give some examples of your country? What are the measures that you take as precaution in your country?
As I live in Saudi Arabia right now, here the measures yes, please. So as I live in Saudi Arabia, I know that the Saudi government, they have adopted a lot of measurements. They are protecting us. They are not letting us to go out, like, and even after not letting to go out, but they do something very good. Like they provide food, then medical, this everything they are giving us free right now in this situation. They are given a lot of measures to follow, and we must follow them according to the law. We must follow them, or we'll get, or else will be fined. But it is very good idea because all the people are following the measurements, and alhamdulillah nowadays in Saudi Arabia still the cases are less, not that much, but still it is increasing due to the foreigners, those who are working daily.
Okay.
So I think, but the people are not gathering like before. People are not shaking hands, and a lot of things they have stopped. Even the weddings, everything are stopped. So I think now we are following them, and if we follow them continuously, inshallah, we can easily fight the coronavirus.
Okay, thank you. Anyone else? Yes, Ismail.
Well, thank you. Good morning, everyone.
Good morning.
And the preventions, the measures taken to fight against coronavirus, are they enough? I think it's enough if only people follow what they are told to do. And there are some people like when the outbreak began, like they were this not true, like, and I don't care. Some people are like, I don't care. So if only people agree or follow the rules, what they're told to do, like the maintaining of social distancing, wearing of mask, and the thorough washing of hands, I think this is enough to fight coronavirus.
Okay, thank you. Yes, Zeynep.
I don't think they're enough because if it was, probably it would be stopped, but it's not. And when we're looking the countries which close the equator, I mean the high temperature countries, in normally virus is just dying in high temperature. But when even we're looking those countries, virus didn't stop still. So when we're looking the developed countries, when we're looking the countries which have good health system, still coronavirus is going on there as well. So we can see that measures are not enough. And they said, like almost everyone said that if people will care about the rules, we can measures would be enough. But if people are not caring, so governments have to do something for this. So when we're looking, if governments are not taking measures about those kind of citizens actions, so again we're seeing that those measures are not enough as well. So when we're looking at America, people are protesting out there with crowd, like, and they're so crowded, and government can't do anything for them. So we
And
can
or
say,
don't want to.
I'm sorry.
Do you think that the governments can't do anything to stop them or don't want to stop them?
They're not stopping it, so they're still they can still do that. So we can say that measures are not enough.
Okay, thank you, Zeynep. Yes, Mariam.
I think they are enough to fight because most of the countries have restrictions, but some of them, despite it has restriction, because of bad health system condition, they are not fighting in a good way. But as we see in Turkey, we have enough restriction for virus, and this is utility solution for this. And most the resolution clearly shows prohibition to go out is a good solution for stopping virus. And most of the countries similar to Turkey, if we struggle a bit, we can stop the virus with restrictions, but we can be patient a little more.
We have to be patient, you say. Okay. Okay, I have a question on this. The precaution that the government is taking, if we like say one by one, okay, we have to wash our hands. We accept that. And if you don't have to, stay at home. If you don't have to go outside, you should stay at home. Okay. And if you have to go outside, you should wear masks and be careful to protect yourself with living a space with another person, right? I have a question on this. Don't you think we are too crowded in the world to leave a space for another one? Right now, okay, we are asked to stay at home, and many of you as teenagers, you are locked down, but somehow it's going to end because we are not going to live like this until the end of our lives, right? At some point, we have to go back to schools. The education has to start. And what do you think? Aren't we too crowded to leave space for each other? Yes, Zeynep.
I think if the situation was like that, in like when people started to leave, if the situation just comes like that, like about social distances, and then maybe while cities are, I don't know, is it the right word, but establishing, or maybe governments would just do them for that way. But now our countries didn't establish in that way, so it's a kind of extra situation. So I mean, it's extraordinary thing. So our countries are not suitable for that right now. So I don't think it is.
Okay, at some point, let's move on to the other question connected with this. At some point, do you think the virus is going to clean out completely? Or are we just going to get used to live with this situation? I mean, wearing masks or washing our hands, I don't know, 20 or 25 times a day. Are we going to get used to the situation, or do you think that the virus is going to be clean out completely, going to leave us? So, Ismail?
Thank you. I think yes, it will. But for this period before when the World Health Organization is about to find the vaccine by the end of this year, before that, this period, we have to control the spread. We have to control the spread of this disease. Everyone should be aware of the virus and how it spreads and the diseases it causes. So if everyone and follows the measures that they are put by the World Health Organization, the spread will be controlled. Like the situation now in Turkey, the spread of the disease is being controlled, like they are at hands. So we have to do so until the vaccine is found.
Okay, thank you. Anyone else? Okay, yeah, Zeynep.
I think at first it would be weird to be so close with the person, and when people are going out, I mean, probably they're going to wash their hands a lot again. But after a while, probably everyone is going to turn their normal life, and probably, except just a few people, everyone we will forget what we had, what we are having right now. So we're going to turn to our normal lives, I guess.
Would you try? I'm sorry. Yes. Jason, yes.
Me, can I speak? So we are already starting to have a normal life, and we are seeing people that we don't used to see like super carefully. Like, okay, we have people that doesn't follow that good that you wanted, but you have other peoples that colleagues of mine that are following like really, but it is kind of a normal life because we kind of adopted the normal life, but we put coronavirus in there. But it is half and half normal life and half that problem.
So you think that this is our new normal? Maybe. I mean, we have to get used to the situation, and then we have to make it our new normal, maybe. Okay.
Yes, it's not the perfect conditions that we want to stop the virus, but it is something, and we can have the normal life.
Okay, thank you. Yes, Abdul.
According to your question, I think the virus is going to vanish if only all the people around the world follow the measures. Wearing masks, social distancing, while going to shops, taking precautions, then there is no gatherings. I think if we follow all the measurements and always wash our hands, keep sanitizer with ourselves, then I think it is going to vanish. But I don't think so it will vanish, because here all the people are not equal here. Some follows, and mostly the illiterate people, they don't follow. But we need to educate them. But still, I think it's not going to vanish because of the people's minds and their way. I think it's not going to vanish. But if we all follow, I think inshallah it will immediately vanish, inshallah.
Inshallah. Okay. Yes, Shawai.
I also think that we have to get used to this lifestyle until the vaccine is found, because the life keeps going, and we have to make kids our new lifestyle until the vaccine is found.
Would you try the vaccination?
Actually, it's a little bit controversial topic, because now people don't trust other people, and because there are people that are using other people disadvantage. But for my health, I will try, I think.
You would?
Yes.
What about the others? Let's say they told us that everything is okay, the vaccination is ready. Would you try it? Or wait for a better solution? Zeynep?
If someone tried and if they didn't die, and then I would try it as well.
But you know, I'm so sorry for disturbing you, but you know that the illness has different effects on different people. I mean, when you hear the people who won the illness are better now, who are healed. Some of them are saying that when they catch the virus, I mean, they couldn't breathe. I don't know, they had fever, but some of them says I kept on coughing, and it has many different effects on many different people. So could you trust a vaccination that because one of your friends has tried it and nothing happens? Can you be so sure about it that it's not going to do anything to you too? Because you know that the vaccination is a kind of virus that again is injected in your body to make your body survive the illness itself.
Probably if my friend tried and didn't happen in that moment, and probably doctors are going to like check their body and they're going to look like what happened, and then after that solutions, I can just try it.
Okay. Shall I?
But there can be side effects on people, like different people and different side effects, and we can't be sure about that.
It's a little bit confusing. Yes.
Uh,
Could you please tell us your name again, because I don't want to mispronounce your name. And
It's okay, it's Joel.
okay.
To a medicine be approved by the OMS, it needs to pass a test. First phase is like a group of small people, then it's going to rise until it is a bigger number. So when the vaccine is approved, is already being tried by millions of people, like a lot of people. So different people, different ages, so we can compare. So it's a bit safe because I try it because it is tried by so many people that it is stressful, I guess.
Okay. I'm going to move on to, okay, Abdurrahman, yes, please.
Okay, according to your question, if the vaccine is ready and used by many patients, those who are suffering from coronavirus, if they're getting cured, and of course we should try, and we can also try if we want. But if we are good enough in health, then why should we try? But if we feel any difficulties, then of course we will immediately try it.
Yeah, it will be optional probably when it comes.
Yes. All right.
Thank you, Ismail.
I've got an answer to my friend here, Abdurrahman.
Yes.
And if the vaccine is found out and when it's tried, tested and becomes successfully, the vaccine normally can take everyone. If you don't have to be a patient so that you can take the vaccine. Normally, there are vaccines. When are vaccines taken? Vaccines are taken before you catch up a disease, before you get a disease, so that when the disease comes, the vaccine in your body will fight the virus. So you remember when we were child, like when we are young, and there were vaccines we were given, even though we were sick. So those vaccines are there to fight diseases when they come, the viruses when they come. So if you are healthy, you can also take the virus. That is.
Thank you. Even if the cure has found, it's going to take time, as you said, to make it ready to use for everyone and to make it for the amount of it to make for all the world to how can I put it? It's going to be hard to reach the vaccination for each and every one. Maybe it's going to take time, maybe 1 year or maybe 2. So my next question is, until then, what are we going to do to make the precautions or measures part of our life? Because you know that life is have to move on. I mean, show must go on. At some point, as we said, we have to go to school. People have to work because the economy part of it, the social life part of it. I mean, we have to live somehow. We have to get used to it. What extra measures can be counted to make our lives much more closer to the normal life? Because you know that it's not a normal thing to be locked down in your houses and wait for virus to get lost itself. So somehow we have to move on. We have to continue, as the education has stopped in Turkey for about, I don't know, 3 months now, and it's going to be, they said that it's going to start in September, and it's going to be like 6 months of time with no teachers. I know we do online works, we do online practices, but still it's not as good as the one we have in schools. So in some points we have to continue, we have to move on. Okay, washing hands, living spaces, wearing masks. These are the things that we know we should do right now. What else could we think as a measure to protect ourselves for the normal life, or to have as much normal as the one we had before the virus? Ismail?
Thank you. As I said, again, until then, when the virus will be found, we have to be patient. You know, health is more important than anything else, health and security. So health is very important. We have to be very patient. We have to we have to be in a lockdown where we have to avoid coming out, meeting people, like maintaining social distance. We have to avoid contact with other people. We have to go to avoid it. So, and if anyone wants to go out, like we want to come back to our normal life, like it was before, we can do so but we need to maintain social distance because health is very important.
I remember you mentioned yesterday that you are in lockdown in Konya and you are unable to go to your country right now. So would you accept the idea that if they tell you that, okay, we are in lockdown and we have to be patient, so you are going to have the same lockdown for 2 more months, how would you feel?
Like it will be hard there, but what if I go, let's say I want to go, which is true, I want to go to my country, but it's a risk taking. This one is taking risk. So taking risk is not that what, you know, if I go, there's a risk of getting the virus. So I don't have another choice. So we are good at here in lockdown. Actually, our teachers are serving as they are doing great job to us. So we can still be patient.
Okay, unfortunately, you are aware of there's not a deadline for it. You know that. So we don't know how much patience we have to show.
I'm not getting you.
What I mean is, there's no deadline for the vanish of the virus. If there were, I mean, if they could tell us that if you be patient for 2 more months or 5, maybe 6, I don't know. At the end of 6 months, you will be free as a bird. we would be patient.
Yes.
I guess it will be easier for us to accept it. But right now we don't have any deadline and we don't know how long it's going to take. And that's why I'm saying that people are getting the feeling of stuck in something. Because it's a psychological war right now for many of us to live within the walls and not going outside, not seeing a friend face to face, not walking in the street as you did before. So it's a psychological war for everyone itself. That's why I'm asking what other things the precautions could be talked about other than the government is giving us right now. Yes, Shawai.
Maybe we can increase the testings for the coronavirus, and we can send them to every region of the country. Like when you go to work, they will test you, and then you go in, and maybe we can continue our lives with coronavirus like this.
Okay, thank you. Yes, Jason.
So, okay. So this is have to be a gradual leave home. So first, we didn't have a so hard lockdown because we could go outside like a 15 meter of your home, like to walk and do sports during the lockdown. But now we are leaving like to work, me to go to school, and it is good to be back to the and you see some of the oldest people like going out because they don't like being stuck at home because their lives are almost over and they want to enjoy the most time they have. It feels like at home they don't have nothing to do because they're old. They can do like activities they do when they are young, so they're basically sit at home watching TV all day. So that's a big a big problem.
Yeah, in the beginning, I think for everyone, it was fun to stay at home because we had chance to do all we couldn't. We had time to read books, we had time to cook, I don't know, we had time to watch movies that we missed because of the school, as talking about us. And many of people who are working out there, they had chance to rest, I guess, because life is hard, everyone is working outside. At the beginning, it was fun to stay at home, but nowadays, it's a little bit boring now, right? Because we get bored of watching movies, we get bored of seeing each other in the same house all the time, seeing the mother at every time, or seeing the same friends. We don't even have new things to talk about. Nothing is left out because. So personally, okay, as Shewa said, governments can work on the finding the medicine or tasting or other things. But personally, what could a teenager do for herself or himself to get used to new normal life? What would you suggest? Yes, Shawai.
Actually, nowadays on YouTube, a lot of people who interest in different like sports or like teachers are helping us with live streams, like they're giving like lessons, or like sport teachers, they're uploading videos which they start like 1 week sports or 2 week sports or something. And I think we can use this opportunity with their helpings, and I think we can watch them, like we can have fun with them, we can make our life going well with them.
How did you handle the, I know teenagers use internet other than like adults and adult people, but how did you handle living with a phone or internet in a day, almost like 8 hours or 10 hours, because keep on watching online education programs, or in Turkey you had to join some TV programs to get education because you couldn't go to school. But it feels like you are living with electricity. If the electric goes on, I mean off, the lights
Mhm.
go off, then the light stops, because
Yes.
we are either with our phones or with PCs, right?
Yeah, we're not equal on that topic. Yeah.
I mean,
And
it was hard for me.
actually I can't estimate what can I do if I don't have these like phones or technological devices. It seems really hard, but I think we'll find a way to figure it out, I think.
This is not our issue to talk about right now, but do you think this is an opportunity to make some new discoveries or something, to explore something, a new thing, a new device, to make the life easier for ones who are locked at home? Might it be a chance?
I actually don't get the question.
You know, most of the time, people are more effective when they are stuck in something. I mean, if you are in trouble,
Yeah.
you find a way to get out of it. So
Yes.
during this situation, I'm asking for all of you, using devices as like, I don't use my hand as much as I use my phone these days, you know? That's why I'm asking, is it an opportunity for some people, scientists or something, to find a new device maybe, so that will make your life easier to feel like normal? Could it be possible?
I think these days people need different things, and this would be a great thing for people right now. Because it's different.
Could
Yes.
something pop up with, oh my God, then you make an invention sitting at home and save our lives right now?
I think yes, because we are now exciting at small things, like everything is different right now, is exciting for us, and it could be a great thing.
Yeah, maybe. Okay. Yes, please, Abdurrahman.
Yes, I think now by sitting in home, other than using mobile phones, we can spend time in, for example, if we are good in writing, I mean, doing something else different. Like if we have, for example, in our days when we were having normal life, we were so busy going here, going to school, going to shops, going to malls. Then we were busy whole week. So I think in this time, by sitting in home, the hobby which we have, we can utilize this time to fulfill our hobbies, to fulfill our dreams, make some new plans for the future. And whatever you have in your mind to do something great, you just think for that, you note it down, make a great plan for the future. I think this is a good option
Okay,
by
thank you.
sitting at home to like that.
Thank you. Okay, for this session, I'm going to move on to our last question. And the last question is the vaccination found right now? And how is it going to be served to the world?
Can you repeat the question?
Is it the medicine for the virus is found right now? Because some of the countries in the world is saying that they done it. And let's say they did. How are they going to share it with the rest of the world? How should it happen to make it as quick as possible for everyone to be able to reach the medication and then be normal again? What would you suggest? Yes, Sarah.
I think they don't have to share with all countries, and they can give us only the recipes. Then we can make the vaccine or the medicine in our countries, maybe. And if the all countries can do it in their countries, and
You know, it's
then
going to be also economical trade. It's not that easy.
but health is bigger than economic trade, of course. And I think the all governments can do that.
Okay.
If the vaccine found.
Okay, thank you. Yes, Abdurrahman.
If the vaccine is found in a country, for example, let's say Bangladesh found a vaccine, they will immediately not give the recipe to every country. They need to raise their economically. They will earn some because to sell with like to America, to Turkey, to Saudi Arabia, those who are rich, they will immediately earn something because they will have chance, because chance are sometimes it comes, it doesn't come every time. So if a poor country, just think of any African country, if they use the vaccine, immediately they are going to sell it. And of course the rich country, if the rich country also find, I think they will also not easily give the recipe, because as you know now the situation in the world, everything is, most of the things are selfish. Like most of the countries are selfish nowadays. They always try to be smart and like they're always trying to be smart, and they will sell it economically like this.
Yeah, that's what I think, unfortunately. Yes. Jason?
So I agree, and I even say more that even if the country gives the recipe so to a country, the economic situation right now, I don't think that they have the capability to, I don't know, form factory to do the medicine, because they, after this is going to be a economic breakdown after this pandemic, and the cure is going to be one of the sources of money that they can do. So they won't sell, and even if the other countries want it, they won't have the capability to do it. Has to be investment too big, and it is easier to buy big portions of the vaccine and give to the people. Is more easy than all this process, and bureaucracy is going to be hard. So it's going to be a lot of problems with that.
Okay, thank you. Yes, Smile.
Thank you. And I think the issue of the health equipment, that's the medical equipment, those countries, the developed countries who have more and can produce more equipments should share to the countries that are not developed. Like just like what Turkey did, countries should share the health equipments to those countries who can't provide, or show how the equipments are provided. And the issue of if the vaccine is found, that the vaccine, if it's found, the World Health Organization will control how it's gonna be and provide, how it's gonna be shared equally to every country. So that's not an issue of which the vaccine. If the vaccine is found, immediately the World Health Organization is gonna get control of it.
So you're sure that they are going to help us to get the vaccination? Because as Abdurrahman said and Joe said, I agree with them, because I think countries are going to try to make use of the situation. They will try to get, if it's a poor country, try to make some money for it. Even if it's a rich country, he's going to try to get richer. So it's a big question mark for me. Okay, thank you for this session. We are going to move on to the next group of questions, but before that, we are going to have 10 minutes of break. Okay?
Okay.
Are we just closing the meeting or?
Mhm.
Okay. See you later. Okay, 10 minutes later, I'll be here again.
Okay.